Assalamu alaikum, iyakan abdu wa iyakan astain. So today I am gonna go through surgery 21st August afternoon paper. So question number 1, the final processing of the carbohydrates in the glycoprotein occurs in the Golgi pretus. The girl presented to her physician with the concern that her mother and the sister died of metastatic breast cancer before 40. She is worried about herself. Which of the following gene is mutated? The BRCA1, BRCA2 mutations. ECG of the patient shows a progressive prolongation of the period interval in the successive beats followed by the dropped heartbeat. Problem lies in which part of the conductive system there is a AV node. The glucose transport in the primary convoluted tubule occurs via the secondary active transport. 45-year-old patient presents with a systolic murmur that is audible up to the neck without use of stethoscope. Which of the following condition is most likely associated with this finding? That is the mitral regurgitation. Increase in the cerebrospinal fluid circulation due to the impaired absorption is most commonly associated with the fault in which of the following structures there is arachnoid granulations after RTA. The massive blood loss, patient undergo shock, BP 85 or 40. Which of the following is important, most important mechanism? That is the CNS ischemic response. Next question number 8, the young female complaining of the numbness and paresthesia along with the color changes in her left arm. There is no washing of the introtia but altered sensation in the T1 distribution due to which of the following? That is the cervical. Which of the following is the common cause of the dioxin toxicity? Hypomagnesemia. 53-year-old patient had the chest pain and presented within 4 hours. Which investigation would be appropriate? That the CK-MB. Next, the friend Friedlander's pneumonia is the primary cause which of the following pathogens? The Klebsiella pneumonia. The toxin produced in the scarlet fever is the erythrogenic toxin. The patient presents with a mass in the mandibular region and the facial deterioration. Which of the following viruses the most commonly associated with these symptoms of Epstein-Barr virus? High concentration of the epinephrine primarily exert which of the following effects on the glucose metabolism? The stimulate gluconeogenesis and the stimulate glycogenolysis. The major blood supply of the intervertebral septum is the anterior interventricular artery. The next 16, the side effect of ACE inhibitors is the hypokalemia. Side effects of thiaziditics is the hypokalemia. In burn patient, the excitability of the cell is reduced with decreased action potential slope due to the hyponatremia. Next, the patient came with a brain lesion and there is a formation of ring. Seen the cornea investigation will be seen there is serum celloplasmin in the blood. The patient with the cirrhosis who presents with acquired bleeding abnormality. The following laboratory finding is the most consistent with this condition for lung prothrombin time. The groove on the left lung is for the arch of the aorta, which muscle action primarily causes shortened and the lateral limb in a neck of the femur fracture, that is the iliopsoas. Doing a chin up as the person raises their arm above their head and then brings the rod in front of the chest, which muscle is primarily responsible for the movement of the arm to the front of the chest, that is the latissimus dorsi. After mastectomy for the breast carcinoma and the removal of the axillary lymph node, female developed winging of scapula, which is due to the damage of the long thoracic nerve damage. Next 25, the patient can't adduct the thumb is the damage of the ulnar nerve. The person has a sharp knife injury in the upper medial aspect of arm, after which he is unable to flex his elbow and having loss of cutaneous sensation in the lateral aspect of forearm. The nerve injured would be the muscocutaneous. The soldier came from the Balochistan, presented in the history of hepatosplenomegaly, fatigue, history of being bitten by some fly, that is the Kalaza. The patient presented the ER with the radio ulnar and the femoral fractures. BP 90 by 60, pulse 120. The initial management would be the volume replacement. The tailor had the TB infection transmitted to the family members. The mode of the spread would be aerosolized air droplets. After C-section, the female presented with incontinence and there is a significant degree in the anal tone. The diagnostic test can be used to assess and monitor the anal sphincter function. That is the anal manometry. The rectal fossa abscess drainage will result in the damage to the inferior rectal nerve. The in-skin damage which later is the first regenerate, that is the stratum basale. The Turner syndrome is karyotype is 45x null in dividing cell chromosomes. Defect cancer cause increased production of the cell which enzyme is related to it. The telomerase, the woman with the history of the tongue bite station loss from the area of the tongue bite due to the damage of the lingual nerve. The patient during the eating increased lacrimation, which nerve would be involved? That is the facial nerve. The old age patient present that increased HPRs, increased TLC, increased platelets, increased with hypoplastic bone marrow. With weakness and lethargy. What's the diagnosis? That is the CML, the grade 4 cervical CA, which lymph nodes are enlarged. The internal iliac, the patient with the 3 to 4 Here, history of urinary intention, now presence of the dysuria and chronic urinary tract infections, which condition most likely causing the symptoms, the BPH. The patient undergoing ascitic tap for the ascites, flooded the costodiaphragmatic recess, where to pass the needle, the T10, mid-axillary, the gentamicin is contraindicated, which are the following condition to the potential for the exacerbation of the condition, that is the CKD. The nail on the wood fell down on the labors dorsum of the foot between the first and second metatarsal bone artery. Most likely damage will be the dorsalis pedis. The stab wound just above the xiphisternal joint at the fifth intercostal cartilage just to the right will damage which structure, that is the right atrium. 45-year-old women having the weight loss with increase T3, T4 degrees TSH. Most likely the diagnosis is the primary hyperthyroidism. 20-year-old male has the dyspnea and the lying down. The structure most likely to cause this would be the retrosternal the artery pulpiti in the trachea, and the infrahyoid is the common carotid. Next, this one is missing. The 48, the dancer moves smoothly and rhythmically in the sync with the music, which function of the motor cortex is primarily responsible for this performance, that is planning and execution of the movement. Vitamin that causes the emanation of alanine and aspartate would be the B6. The elderly woman presents with the low hemoglobin, high MCV, and the ataxia, which is the most likely cause of these symptoms. The vitamin B12 deficiency. The patient, the history of the third degree severe burn cause damage the spinosum, granulosum, and the bezalis effect will be the cutaneous water loss. Next, which of the following is a cancer risk reducing the food? Orange, the patient presented with the megaloblastic anemia. On the investigation, there is orotic acid in the urine leads to increase in the senses of which of the following: the pyrimidine. The prospective cohort study involved the tracking exposed and unexposed groups of time to measure the development of the disease. The patients with the asbestosis diagnosis, the restrictive lung disease, which is the expected change in the pulmonary function test, that is FEV ratio, FVC ratio increase. Which of the following is least likely to contribute to decrease repair after acute inflammation? Increase age. The patient with the normal protein diet but decrease intake of the fruits and vegetables experiences slow repair after acute inflammation. The following is the most likely reason for the late repair. Decrease sensitivity of the type 3 collagen. The treatment of diffuse large beta cell lymphoma is the surgery in the chemotherapy. Right shift of the oxygen dissociation curve is caused by the increased partial pressure of the carbon dioxide. Next 60, while moving from the spine to the standing position, what is the primary compensatory change observed in the cardiovascular physiology? That is increase the charge. The spinal electron effects on the excretion in the urine is increased sodium and decreased potassium. The patient with the spinal cord injury at the T6 presents with the severe hypertension, pounding, headaches, and the sweating above the level of the lean. Most likely cause of these symptoms, the autonomic dysreflexia, mental lethargy, weight gain, and the cold intolerance. The test order would be the serum TSH. The patient with the bronchogenic carcinoma proceed to the left lung hilum, which structure is likely to be damaged. The figures now. A 27-year-old woman requires a mammogram because both her mother and the sister died with breast cancer before 40 years of age. The following would add to this patient's risk factor for the CA breast, that is the BRCA1 mutation. The young male living in the populated town died in an arterial autopsy. In the lymph nodes of the lungs are found black in the color. The following says in the condition the patient, that is the anthracosis. The patient has a complaint of polyuria, but the blood glucose level in ADH is normal. This is basically the nephrogenic diabetes. The ischiopubic rami fuses at the 7 years. For the prevention of the treatment trachoma, what should be done? That is the washing of hands and the mouth. Zagotes meningitis in old age is the ceftriaxone. The sexually active young female having UTI gynecologist by urinary shows. The pus cells organism is the gram positive, catalase positive, coagulase negative, which organism is involved, that is the Staphylococcus saprophyticus. The young girl, the history of the gum bleed after extraction. Platelets and the platelets count is 1,20,000. The diagnosis is the Bernard-Sollier syndrome. When the activated partial thromboplastin time is prolonged, then prothrombin time is normal, which clotting factor is most likely involved as factor number 8. The patient presents the mucous bleeding and easy bruising. The following the most likely cause of these symptoms, that is thrombocytopenia. The aspirin used to alleviate the arthritis pain primarily due to section increasing which of the following? That is a prostaglandin. Which of the following structure lies deep to and the parallel the carotid sheet, that is sympathetic chain. The person came with abscess formation. The foot staph aureus was present in the tissue kept under observation for 24 hours to see the role of the lymphatic, which role lymphatics will play the presentation by the antigen presenting cells. The following physical disease can arise from the streptocardiovascular disease and psychiatric disorders. The anterior, the sternocostal surface of the heart is formed by the right ventricle. The child is diagnosed with the initial meningitis, and the parents are concerned about how the infection might spread. As other siblings have also been infected, which is the primary mode of transmission is meningitis, that is respiratory droplets. Patient in the OC surgery is being done. Patient needs bladder emptying. The surgeon passed needle to upper surface of bladder and the vessel. The risk of the damage would be in this case, that is option is totally missing here. Next, 82, left adrenal gland anterior relation would be the lesser sac. The melanoma invade the optic cavity through which of the following the medullary veins. The major input to the motor cortex with the ventrolateral nucleus of thalamus. The man smoke 20 pack per month. Work the factory develops lung cancer, which carcinogen in the cigarette has lung cancer, that is a polyaromatic hydrocarbons. Next, 86, the diabetic patient after cholecystectomy develop the dyspnea. Most likely pathology would be the pulmonary embolism. The sympathetic nervous system increase the blood pressure. Primarily by which of the following mechanism the vasoconstriction of skeletal muscle pain of the pericarditis is carried by the phrenic nerve. The bone spicules found in the muscles around a month after the injury to the said muscle. Which type of the response is the metaplasia? Gastrocnemius size reduced after cast applied for few weeks of the fracture is most likely due to the decreased protein synthesis, increased degradation, lymphatic drainage of the external nose, and the anterior part of the nasal cavity is the submandibular lymph nodes. The patients having the high glucose levels, low insulin effect on the lipid metabolism, that is a ketogenesis. The patient keeps crying about still passed away. What is the most appropriate response from the doctor? Take your time. The arteries coursing around the base of the renal pyramids, the arcuate artery. Coronary village sampling test done at the 11 to 12 weeks. The craniopharyngioma occurs from a structure that is embryologically derived from the stomodium. The patient having the tachycardia, abdominal distension, and the hypertension after laparotomy due to which of these above living show the patient present the bleeding from the post renal ulcer rupture, which of the following artery is responsible? That is the gastrorenal artery. The surgeon is performing pancreatitis to prevent the maximum blood loss. Which artery should be ligated into the second part of the duodenum? That is the inferior pancreatitis artery. The 50-year-old man known to have the hepatoma develops the dependent edema with the abdominal wall veins, the most likely structure involved in this patient, the IVC. Next, 100, the lesser omentum contains the hepatic artery proprioceptivity in the portal. When the patient presented the hepatitis biomarkers negative, ALT slightly raised in the examination, they were KF ring seen. What is the suitable diagnostic test? That is the urinary copper. The child has history of the Picanov, has the pallor, fatigue, and the low HP. What is suitable diagnosis? That is the iron deficiency. The woman develops the gaze disturbance on looking to the right. Her right eye remains in the middle and also decreased corneal sensation. She also has a hearing loss on the right side. DN is at the cerebropontine angle. The most common locally malignant carcinoma is the ameloblastoma. The old lady, that is phagia, she ignored, but after 3 months came in the weight loss and the dysphagia to the puddings milks. Now on exam there is a mass in the deep neck on palpation magnesia. Which organ is there? The larynx. Which of the following is the non-specific defense mechanism? NK cells. The real female present with the nausea, vomiting, gastric ulcer 5 days, biopsy stomach shows the lymphocytes, neutrophils, macrophages, plasma cell, no ulcerations. The most probable diagnosis is H. pylori. 3 days after the cholecystectomy, the patient experienced dyspnea and hemoptysis, which is the most likely diagnosis. The pulmonary embolism. Liver cirrhosis patients with the coagulopathy transfusion before the surgery by which flood? That is FFP. Which is the following structures primarily affected by the retinal hypertension? That is the retinal artery. Which is the following. Since the finding typically in the bacterial meningitis, the increased protein unknown. The patient developed edema. The likely mechanism is the decrease in cardiac pressure. Next, 113. The patient, 25-year-old man, presented with the complaint of the postprandial bloating, abdominal cramping. His history of the passing foul-smelling stool, which is the investigation, multiple information regarding the problem that is stool here. When a soldier climbs to the high altitude, which is the following metabolic abnormalities observed in him, the passage of the time, that is the removal of bicarbonates from the body. The patient present with the unconsciousness in the ER. Blood glucose level 400 mg/dl. PSM improvement. What will be the most important buffer in the plasma in this patient? That is the bicarbonate. Next, 116. The after GFR decrease in the patients came with excessive bleeding, which is the cause of decreased GFR, that is the decreased arterial blood flow. The conversion of fibrinogen in fibrin catalyzed, which is the following enzyme, that is a thrombin. The patient has the following ABGs, pH of 7.2, bicarb 19, and perspiration of 39 is the likely diagnosis, that is the metabolic acidosis. 25 women previously healthy present in the colon mucosine for 25 days. platelet count 12, and the hypoplasia of the macrocyte. The diagnosis in this case would be ITP. The 10 years old child in the ecchymosis. Most important initial test is the platelet count. Women and the men in the history of recurrent pregnancy, their clinical and the genetic history is remarkable, but pregnancies end up stillbirth. How we investigate that is the karyotyping, but now responsible for the numbness in the medial thigh and the medial leg, that is the stiffness. The patient is taking this session and the peripheral body in the lab investigation with MCV and hyperthermic neutrophils. That is definitely vitamin B12 deficiency. Next, 1 to 4, the gastrectomy of the patient done. The patient begins taking this session, then needs vitamin B12 injections. What cells are destroyed? That is the parietal cells. The 40-year-old child present with the testicular swelling. FP levels were done, which were raised. So tumor was resected, after which the AFP levels dropped. So normal child was suffering from which tumor? That is the oxide tumor. 45-year-old patients present with the symptoms of excessive heat production, sweating, measuring with the space occupying in the brain. The areas most likely affected the hypothalamus. 12-year-old child became the OPT. He seems to be 7 years old. He has a mental retardation cause of the abnormality is the thyroid hormone. 1 to 8, the feature of acid for baseline. The TB is the mycolic acid. The boxer hit on the mouth of the person who is unable to open mouth, and the upper region of jaw what muscle is damaged. That is the lateral pterygoid. The 3 years after delivery, severe pain at the episiotomy site. Mother is also lactating. Doctor choice would be the ibuprofen. The following is most important sign of the reversible cell injury. There is the hydrophic changes. Homosexual male HIV positive has the fever, dry cough for the weeks. Atypical mycobacteria shows the cause would be the mycobacterium. Next, the newborn is brought with the lumbosacral swelling containing meninges without neural tissue. What is the most likely diagnosis in this case? That is the spina bifida meningocele. 134, the recent memory loss occurs due to the lesion in the hippocampus. The patient, the humeral fracture, experiences nerve damage after the nerve injury. You are in the potential for nerve regeneration, which of the following nerve is least likely to regenerate successfully? That is the distal to the axons. The following is the false regarding the transmission of the action potential. Dendrites are important contributors to the action potential. Loss of the crude touch and the pressure is due to the lesion of which tag, that is the anterior spinothalamic tract. Next, 138, the patient, the severe headache, vomiting, and neck stiffness is IC with the lumbar puncture. Blood and CSF diagnosis is the subarachnoid hemorrhage. Immediate effect of the local anesthesia on which fibers? That is the C fibers. Characteristic of the C yacht is the hyperosmolar. The proprietary drug of choice for the Graves' disease in the pregnancy. 142, the 60-year-old male with the spleen migraine and lymphadenopathy. Stomach cells. Blood shows the lymphocytes, eosinophils. That is the Hodgkin's stage 3. The patient has given a sinus thrombosis which now will be affected. Abduction. A ligament pierce at last during epidural is the ligamentum filamen. Drug causing the thrombocytopenia is the quinine. Young thin lean boy with the sign of the tetany have the blood calcium level of 6 and the urine excretion level is 50. What will be the cause? Vitamin D deficiency. The person is sitting with the eyes closed. What will be appear on the EEG? That is alpha waves. What about the necrosis seen in the brain? That is refractive necrosis. 70-year-old male in the 6-month history of the fingers turning pale. The Raynaud's phenomena, dyspnea, no tight novice with novice, and HP is 10 and a positive. That is the scleroderma. Next, 150, the patient reports loss sensation from the chin down to the supraclavicular region. The cervical nerve roots are most commonly involved in sensory loss, that is C2, C3. The group of the mice was taken and the injection of plastic hydrocarbon was given. This is work as initiated in the process. The initiator work as the memory produce. The structure damage in the parotid gland. Surgery would be the facial nerve. The girl with the cyclic abdominal pain every month with the presented with the PA exam normal, hymen ring normal. The cause would be the cervical atresia, which is the following: the pain mediated inflammation, that is the bradykinin. That woman present the 12-week pregnant. Present the miscarriage accompanied the second vaginal bleed. The portrait reveals the coagulopathy, but she shows no signs of shock. What is the most appropriate management strategy? Uterine evacuation combined with the FFPs. That's it from this particular paper. Thanks for watching my video. Do subscribe my channel. Until my next video.